All right, so week 2. Let's go over what's all due and everything this week. So we've done our quiz, and there's another discussion question. Now, you will notice I have graded all the discussion questions, and you all got a perfect 20. And it's just because it's the first week. There's so much movement. Some students made a discussion question and then had to come to another class and it was wiped out. So to be fair to absolutely everybody got a perfect score on it. It doesn't mean your discussion question was written perfectly. And I will let you know coming up on week 2, maybe it's probably citations I've seen in some of them that haven't been there, or I've even seen a couple that didn't have a reference at all. Remember, your book is a perfect reference to use. When in doubt, use the book as your reference because the question's going to be in there somewhere, somehow, okay? So also, as I said earlier, always read the comments I put in your discussion posts. You take time to do them. I take time to give you a little bit more. And if you have questions, I will answer them in there so that you've got your personalized answer there. I go through every discussion question and look for them. So that's that. I have already loaded
You can turn that
your
light off.
all of your exam study stuff will be coming at Saturday at midnight. You're going to be getting all of the Kahoots that we'll be doing. You're going to be getting the study guide that I have just redone. You're going to get videos on dosage calc. You're going to get a dosage calc quote exam 1. If you can do exam 1 dosage calc, those are the types of questions. Different numbers, same types of questions, okay? So you've got everything to be extremely successful. So that'll be coming Friday, or Saturday, excuse me, at midnight. Now, next week is all of the reviews. I don't have all the professors in yet. I believe I'm doing mine Tuesday at 2 or 4, one of those times. Again, they're all recorded, they'll all be posted. And if you know me, in my YouTube channel, you can already look at a review because you can look at last terms. There's a couple differences, not much, but you can, if you want to, you're like that, you want to study quick, well, you have the information already, in your hands. You can use that stuff. Patience, are you going to be coming on camera, please?
I tried
Does
calling
anybody,
her. I
yeah?
tried calling her and texting her, so I'm not sure.
Okay. I'll come back in a couple minutes. If she doesn't come back on, I have to remove her, and I do not want to do that. So let's just go on with our PowerPoint today. So week 2. I think it's my favorite group of children. It's the little ones. They're just so unique, so pure, so honest, and so lovable, most of them. And I just always love the challenge of a small child. It seems that if there is a child who's small, especially toddlers, that does not like anybody, they will come up to me and sit on my lap, and the parents go, "How did you do that?" I don't know. I've got one of those, I don't know. I can calm the wild, I guess what it is. But children, how do you do that? And all these kids, and let's figure out how to assess them, right? Now, infants, probably the most, and it is the most physical development in any length of time. They call it dramatic. From 0, which is birth, to infancy, which is up through age 1, they have gone from 7 pounds at birth, 14 pounds at 6 months, 21 pounds at 1 year, triples their birth weight. Not only that, their height for the first 6 months grows 1 inch every month. So can you understand why they need so much nutrition? They don't get nutrition. They don't get what they need. They were not going to grow the way they should. And just think mentally, cognitively, they didn't even know how to breathe when they came out of mommy. And initially they started to breathe, suck and swallow, right? So now they can drink a bottle. And then they did that reflex grasp of the hand. It's these slow, steady movements. Now, again, if they are not moving where we want them, they don't have to all be up to 14 pounds at 6 months. It could be 13 pounds. That's all right. It's when it gets lower. But again, if we're not getting that nutrition, they're not going to be doing all of these little developmental milestones that we're looking for, okay? And that's why we look at weight so closely in especially your first year of life, your infancy. So infants born, heart rate, 140 to 160. Like that's the number that it's a normal number. You're going to see a little different in some books, but it's basically fast. All right. And that's at rest. Heart rate, respiratory rate, 40 to 60. As that baby gets older, the heart rate, respiratory rate slowly slows down. It just means that the heart and the respiratory, the lungs are a little bit more effective. So they don't have to beat as fast. That's all it means. Okay. Now, hemopoietic, those bloods, what's going on? Well, initially, babies don't make their own red blood cells. We know that everything came from mommy. And initially, we've got great hemoglobins, but we know normally red blood cells die. So a lot of that red blood cells die. And what's in red blood cells? Iron, right? So usually it becomes most drastic where this loss of red blood cells, baby's not making yet, they go into what we call a physiologic anemia, which is okay. We expect it. Normal hemoglobin, 9 to 10 on a 6, 7 month old baby is not abnormal unless they're symptomatic. But most infants do very well on that. And at 6 months, we are going to start to feed these infants. And we also are going to feed them food with iron. It's iron fortified formula. It's breast milk with vitamin D, which also helps, with muscles and iron that we do need. Okay. So, and then the baby also starts to make their own cells. So 6 months, you're going to have a lower hemoglobin. Now, at birth, that baby's head came out and it's the biggest part of the whole body, right? By the time they're about 12 months old, the chest, which was smaller than the head, is now larger, or at least equal to. And that's one of the changes that we look at to make sure head and chest and the measurements are looking correctly. Another thing with the head is we have two fontanelles. We have one in the back, posterior, and the one on the top called the anterior fontanelles. Now, these close at certain times, and we need to know when they close. So if they haven't closed yet, why haven't they closed yet? Is there some swelling or something that's keeping that from closing yet? The one in the back, by 6 to 8 weeks, is gone. In fact, hardly you get a chance to feel it, and the baby's already closed that fontanelle, and that's normal. Now, the one on top, it should be completely closed by 18 months. If you find it still open and there's a big space there, what could be a possibility? Well, it could be brain tumors, it could be hydrocephalus, or just some sort of problem with bone development. And it really needs to be checked by the physician, and they'll do a workup. Why is that fontanelle still large? It's one of the reasons why we do head circumferences on all younger children, especially the first year of life, and especially if we see a fontanelle open later than we should think it should have been. Another thing with children, babies born, they have two eyes and they work individually. They don't work together yet. What does that mean? Well, if you reach for something, both of your eyes figure out that depth, that perception. How far do I got to go to reach it? Well, with one eye working against each other, you don't have hardly any depth perception. By about 9 months, it's this binocularity starts to correct. So your eyes become more, you start to hear a lot better. It's all part of growing up. Now, the immune system is given again by mom. And we know that what mom gave us and all these immunizations we're going to be giving this child in the first year of life is going to get their immune system to a place where it can fight off those big bad diseases, right? We know breast milk is constantly given maternal antibodies to the baby, and that's why we recommend it. We know by 6 to 8 weeks, the baby can respond to an immunization given to it, which means they can build up their own defense from now that immunization. At 9 months, they're developing their own immunity, which means they get a cold, a virus, and they fight it off just like we do. Well, that baby now can make those, antibodies. So if they get that type of virus again, they can fight it off. Now they're building up that immunity. They're becoming sick lesser and lesser as we go on, as we keep getting these diseases. We know there's all things that protect them. That Vernex is something, that cheese at birth. Again, it's just a protection. The body's done something to protect itself. Now at birth, babies are born out of nice warm fluid, comes out to a cool, windy environment, and this baby cannot control its own temperature yet. So needs immediately to be dried off and put under heat. I'll tell you a story of what happened to me when I forgot to turn a warmer on after a bath. I know if a baby gets cool or colder, the heart rate will go down. I had was a full-term infant, gave it a bath. I forgot to turn the warmer off when I was done. And I turned around and I saw the heart rate was 99, which is not horrible, but it was lower. Usually it's 100, 120, full sleep, full-term infant, which is great. And I looked and I went, oh, the warmer's off. Turned it back on. I mean, the child was 97, not crazy, but cooler for that infant. As the baby warmed up, the heart rate went back up. So you see a baby, heart rate's lower, check the temperature. I'm sharing you one of the things that happened to me so that it won't happen to you. And that's what nurses do, sharing things like that so that you can share it to someone else. Just, help another baby not get cold, right? Now, fine motor skills is F fingers. Now, I want you to know there's gross motor skills and fine motor skills. And you have to be careful when you're reading questions regarding either of these motor developments. Fine motors, fingers. Gross motors, get up and go, 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 like Paw Patrol. Okay? So when we're talking about fine, it's fingers. We talk about prehension, is another word for grabbing a hold of something. That starts happening about 2 to 3 months. And it starts out with you put a rattle or you put mommy's finger next to this newborn infant, right about 2 months old. That baby, out of a reflex, will grab it, a reflex palmar grasp. And the mom goes, oh, my baby just grabbed my finger. He's giving me a hug. Now, don't tell him it's a reflex. The mom thinks it's a nice thing. So I wouldn't blow that out of their mind. I think it's a special moment for them, especially if they're in a hospital newborn ICU, right? Now, after the palmar grasp, it becomes voluntary. So first of all, it just happened to happen. Well, then it was like, ooh, that wasn't a bad thing. And then it becomes a voluntary. They can grab that rattle. Then they could take the rattle and put it from hand to hand about 7 months. Now, at about 10 months, this child is now sitting in a high chair, and you're putting little pieces of food out in front of that child, right? And they take their hands and sort of smush stuff in their face. That's called a pincer grasp. It's that hand and fingers into the mouth. It becomes fine pincer when they take the thumb and forefinger and take a little Cheerio and a little Cheerio very finely. That's about 10 months. Now, with the hands, they should remove objects from a container about 11 months and build a tower, a box of 2 by 1 year. Now, they're not all at exactly that month, that date, that minute, that hour, but it should be moving forward. You should be getting more and not regressing with what fine motor development's being done. And that's just a test for you. Now, gross motor skills. This is only about movement. Okay, so fine motor is only fingers, what I do with my hands. Gross motor is moving, whether it's my head rolling over, crawling, walking, creeping, all of that is movement. So first thing that happens is head control. Now, if you look at the picture on the upper right, you'll see holding that infant and pulling up, you see the head lagging to the back. That is called a head lag, and that stops about 3 months old. Because you know at birth, babies have that bobble head, and you really got to support their head. About 3 months, they're getting control. If you look at that middle picture, now that child's probably about 4 months old, and now they're pulling themselves up. The head didn't fall back. That's head control. And then eventually the whole thing comes up with it. Now, rolling over. Very important that we know and we teach. This is a safety issue. This baby is now turning over. They start with their abdomen to their back, and then from their back to their abdomen, and they roll over. The thing is, they can roll off of beds, changing tables, um, couches, chairs, and it's something we need to teach. You know, I've got a new baby around, a 5-month-old baby, and my daughter walks away with this baby in the changing table, and I'm like, do you realize this baby can now roll? You need to have a harness on him or keep your hand on the baby. And she goes, ooh. I said, yes, 6 months they roll. And at working in an emergency room and working in triage, I saw many a young infant parents upset because they rolled over and fell on their heads, because they didn't watch them, they didn't know, they turned for a second, you know, they don't mean to, but it does happen. So, but we could prevent it. Let's teach. Another thing is sitting unsupported. This is no toys, no pillows, nothing. Sitting by themselves, 8 months old. And then about 10 months, they can go from their backs and they can sit up. And that's a big thing for them. Now, locomotion. Always we call locomotion head to tail, right? Look at the word cephalic. Cephalic means head, right? Head control starts first. What's the last thing that happens first year of life is they walk. So it's head to tail and what goes on. So first they move their head, then they start rolling, then they start crawling, they start creeping. And then about 11 months, some are earlier, some are later, walking with assistance and walking alone or attempting to walk alone about 1 year. You know, they say, oh my goodness, my baby's not walking and they're 1 year old yet. And my other baby walked at 9 months. And it's okay. My two children never walked at 12 months. At 15 months, they ran. We had a babysitter in the house and so, oh yeah, your daughter's walking. I said, well, how many steps did she take? And they said 76. I said, I'm sorry, that's not walking, that's running. So again, it's about 1 year, but it could be a little more, a little bit less. First year of life. All we're giving here is breast milk, or we'll be giving iron fortified formula. We don't give any more than that because the intestines doesn't tolerate it yet. We know they should breastfeed 8 to 10 minutes on each side, and we know they're getting enough milk if they're having 6 to 8 wet diapers every day. And the other thing is vitamin D must be given for breastfed babies. It helps again with muscles and movement, etc. As I said, we don't give any stool, anything the first 6 months except for the milk, iron fortified formula, or breast milk, because the stool, you'll just see it in there. Now, there are times, and you'll see it as we move forward, that we might put a little bit of rice cereal in the formula, and that would be for a child with reflux, right? You might see a little bit of rice cereal in the stool, but it was worth leaving it there and having it there because they kept the milk down. So you have to look at all this effort to eat this food. Did we able to absorb it and use it, or is all that effort just burning calories and now I'm behind on calories? But in this case, it would be a good thing because they're getting more milk, which is where they're getting their calories and nutrition. Now, the second 6 months of eating in for infants, we start to introduce food. Rice cereal is actually the best first food to offer. It's the least higher allergenic of all the foods out there. We should be introducing one at a time every 4 to 7 days, and then you can introduce another one. Now, there are allergies and it can happen early. And you might have a kid who gets really this bad, with eczema, where they're always full of rash and it gets infected and then it starts to get dry and it flakes. And a lot of it is not just only environmental, it's food allergies too. So, how would we know if we were giving a child a food the first time if they had an allergy? Well, the easy one is anaphylaxis, right? But besides that, it could be a little red rash. It could be vomiting. It could be diarrhea, abdominal pain, or a diaper rash. Sometimes diaper rash is telling you they're not tolerating it. Again, they'll either say, all right, let's stop the food now, or let's go ahead and keep going to see if, because it's a little rash, try to get the food in that's trying to desensitize them. But this poor little child, the allergies, it's the lotions, the creams, it's the environment, it's the detergent you wash with, it's everything. Now, babies should be sleeping a lot, about 9 to 11 hours a day. Breastfed babies are going to wake up a little bit earlier and more often. I always thought breast milk looked thinner than formula, so maybe that's the reason why. I'm not sure, but they'll wake up more frequently, and it's absolutely normal. And we know that babies nap frequently during the day. They say walkers, swings, and playpens are not necessary, but those swings, I think every parent will tell you, we love them. They like to rock, they like the motion, it helps with them. Again, personal choice, but the book says no. Dental health. They say the first tooth should come in 6 months. It doesn't mean you're getting a tooth at 6 months. Some kids don't get any, and then, like, of course, mine again, they didn't get any, and at 15 months, they got six at the same time. And that's normal too. Fluoride should be introduced at 6 months, and only toothbrush for cleaning. One of the things that help can prevent what we call bottle mouth is no bottle propping, especially with juice or formula milk. That can all has sugar in it. It will decay the enamel and it will decay the teeth on the baby. So they say no bottles in the bed. Use a pacifier. It's a better choice. They know how many teeth you should have by months of how the age of the child in months minus 6, which is 6 months, the first one that they should get. And that will be how many teeth is a possibility. Now, immunizations. If you looked in your book, there is a double page, right? Double page of immunizations. And which and how do you need to know all of these things? Well, you need to know hepatitis B is the first one that's given, usually given at birth, or the first 2 weeks visit, the first visit they give it. What do you need to know about some of these others? Well, measles, mumps, rubella is at 15 months. Varicella is a live vaccine, and you have to take precautions when you're administering that vaccine, okay? And influenza cannot be given to an infant until they're 6 months old. We'll talk about HPV when we talk about adolescents next week. Colic is a concern of infants. It's really a difficult thing that happens where the baby has all this gas, and they usually by 3-4 months it goes away, but these babies don't sleep, and it's really stressful for parents and for the child. There's all sorts of sleep problems. They sleep too much, they don't sleep enough. And then there's something called failure to thrive. This would be that infant that born at 7 pounds, came in at 6 months, and is only weighing 9 pounds. Why aren't they gaining weight? And then what would you do? Well, going to do a complete medical workup. I mean, first of all, you start basics. What are you feeding them? How often are you feeding them? And then that's your food diary. Anything that has to do with weight gain, anorexia, anything, first of all, first thing you're going to do, any age child, is a food diary. What did they eat yesterday? What did they have for breakfast? These are those questions that you would ask. Another thing that many parents get concerned about, especially today when they're concerned about SIDS deaths, sudden infant death syndrome, which happens in infants ages birth to 1 year old. And it's when all of a sudden they stop breathing and they die in their sleep for no reason at all. Why we put them on their back, research has proven that there's less incidence of SIDS. So the flatness on the back of their head is because they're now being put on their back all the time. And parents are like, but my baby's head is flat and I don't want it to look flat. Well, what can you do? There's two things. One of the things we're taught with infants is to put them on tummy time several times a day. If you've ever felt an infant's head, it's nice and soft. And just that couple times a day, tummy time, can help that head round out. So you really can help it get back without that flatness. Just keep doing consistent tummy time. The other thing is what I call the helmet head, where we put a helmet on the child's head. This is usually for that child who has been in a side lying position, and I'll explain how that could happen. And their head is on the side for extended periods of time. Could be a week, could be 2 weeks. There's some times where a baby at birth, they cannot breathe for themselves. And they have to put them on something that looks like a heart lung machine, but it's basically just oxygenating the baby. It's called ECMO. And they have two big catheters in their neck. All right. So they have to keep their head flat on the side. That head's going to be flat on the side. So, how do we correct it? This child would get a helmet. Diaper dermatitis. This happens for no reason sometimes. Probably one of the biggest reasons that a normal baby, healthy baby, wakes up at night screaming is because they have a diaper rash. Because once they stool or have urine, it burns it, so it hurts. What causes these diaper rashes? Well, it could be foods. We've already talked about that. I know that my children could not wear Pampers. They could only wear Huggies. But my grandson could only wear Pampers and not Huggies. So some children are allergic to a type, or could be that A&D ointment they don't like, but they like Desitin. It could be they don't like Johnson and Johnson baby shampoo. They like this other type. It could be the laundry detergent. It could be so many things. Anything that you put on a baby or around the baby can cause a dermatitis. So again, it's taking away the stuff you've just added and trying to clear it up. Just continue to wash it with soap and water. Try to keep it clean and dry, and that's all you can do. Cradle cap. Sometimes babies are born with all this extra flaky skin, and they want to know, how do we take care of it? Well, you've got to just wash it with normal baby shampoo and water, soap and water, and then some sort of baby oil moisturizer, and you just gently, massage it into the scalp. Then you take a fine tooth comb or brush and softly comb and brush it, and slowly it will go away. It's not going to be gone in one sitting, but it will go away when you're on top of it and continue to care for it. SIDS death, we've talked a couple things about it. So let's say, what are the risk factors? Well, some ethnicities are more than others. Males are more apt for SIDS death than females, more at nighttime, and usually 2 to 4 months is that high worrisome time. It's because of sleeping prone, cigarette smoke, overheating. What about a baby who just had a little upper respiratory, little mucus in the nose? Mild respiratory infection can cause SIDS death. If a baby is breastfed, there's decreased chances of SIDS death than formula-fed baby. It also could be poor socioeconomic, not getting immunizations, and of course, air pollution can all be part of it. Also using soft beds. We want a firm mattress. Alt-T is a thing that happens to infants where I call it a big choking event. The baby all of a sudden gags, chokes, stops breathing, turns blue. It's like you all ready to cry, and nothing comes out. And the parent tries to shake the baby and pat the baby, and it takes a long time for them to breathe. And then that mother is like, oh my goodness, something's wrong with my child. And of course, brings them into the emergency room. What we'll do is a complete check. Was it reflux? So we do a GI check. Was it neurological? We do neurological checks. And we will send them home on this apnea monitor. If you've ever seen an apnea monitor and heard the alarm, it is an extremely sharp, ear-piercing sound. Now, during infancy, talking about, health and protection, safety, infection control, you always, should think about how can we be better with our infants? Well, safety. Infants, let's make sure that we have them in a rear facing car seat, that those shoulders are nice and snug. Use rolled blankets, just get them in there snugly, or underneath them. It's nice and soft, get them in there tight, and that will protect them. Another thing is having parents being taught them CPR in case of any problems. There is a question on CPR on your exam. Do you know what one man or two man CPR is? You walk into a room, you find somebody not breathing, not heart rate's not going, you're going to be doing what? 15 to 2 or 30 to 2, you need to know which one, okay? And then, of course, any age child, water safety, making sure there's fences up, alarms up, etc., for children falling into pools. I've seen it too many times. Now, Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention?
Is it C?
It's absolutely normal. Yes, it is. Okay, let's review the theorist for your infant. So, as you're looking at these, that's what I want you to think about so you can figure out the answer easily. Erickson talks about how that child responds to people around them. Okay? Piaget is how they think, have they learned. Once they got that rattle, they shook it. Are you formal operations? Can you figure things out yourself? Or concrete operations? I had to see that piece of concrete or see it, feel it, touch it, smell it in order to be able to replicate that. Okay, what is it? That's Piaget. Freud is anything sexual, anything, oral, anal, anything. And then Kohlberg, it's all about morality. And actually, Kohlberg starts as a preschooler because infants and toddlers don't have a morality yet. They don't know right or wrong yet. So if you can remember that, we can figure out which theorist belongs to who. So Erickson, talking about people around him, an infant. What does an infant want from the people around them? If I'm hungry, I want to be fed. If I'm dirty, I want to be changed. If I got gas, I want to be burped. Or if I hear you, I just want you, right? So if somebody goes and takes care of them, consistently, that baby trusts that their needs will be met. They're a happier, healthy baby that's easier to take care of because they know when they call, somebody's going to take care of them. What happens if they're in a relationship with their adult that, for whatever reason, consistently, not one time, consistently, nobody comes get them when they cry? We call that mistrust. This is usually in situations like drug abuse, alcohol abuse, homelessness. There's something else going on, but it is mistrust. It is a constant nobody going to get them. And of course, that can cause these things: narcissism, the grasping, the biting. They want somebody, they're doing anything to get your attention. Now, Piaget, we're talking about these schemas. Well, what is a schema? Well, I told you the baby's first thing they do is they reflex. They grab that, let's say it's the rattle. All right. So that reflex, they did that. Well, then they moved it and it made a really neat noise. So next time, I'm going to grab that by myself and I'm going to shake it because, oh, I like that noise. That's what makes me happy. I'm playing, right? Well, all of a sudden that rattle, oh, fell in my mouth. Oh, I like that too. So now we've taken a reflex, made it a voluntary grasp, and now we're sucking on it because that's giving me happiness. That is the building up of things as we start from little things and we go further. It's just like all of a sudden the finger falls in the mouth and they suck on it. Same thing. Start with something little and then we make more. We can breathe. A bottle went in the mouth. I could suck and then I learned to swallow. Breathe, suck, swallow. Little schemas. So it's thinking. And we have these names that we use. Sensorimotor is all what young little children and infants do, right? They put it in their mouth, they feel it, and they move things around. Sensorimotor, right? As we get older into toddlers and whatnot, then they get more imaginable and thinking more and magical there and goes onward. I'm not going to go any more into it. Just know infants, it's all about touch, mouth, moving it around. That gives them comfort there. Now, body image. Well, infants, as they get older, yes, they're going to start them seeing themselves. They start looking at their hands, their feet come up and they go in the mouths, and we're looking at everything, right? That's how they're explaining those. There's something that, as they are on and doing tummy time, something called object permanence. As they're in that playtime and they're on their tummies and looking around on the floor, you take their favorite little stuffy toy and you show it to them, but you put it behind something underneath a blanket on the other side. So they've got about 5 feet. They've got to, scooch you over to, right? Now it's hidden. That infant still knows, even though it's hidden, it's still there and I'm going to find it. So that's the basis of object permanence. Even though the object is not in visible sight, that infant knows if they go looking, they're going to find it. Social development, people around them. Well, of course, they only want mommy or daddy or nana, whoever that person is. There's something called separation anxiety. Separation anxiety, I'm going to talk more about this, I think week 4, but separation anxiety has to do with if you have a child who has to be in a hospital without a parent or a caregiver, they go through stages of, oh my goodness, I'm here by myself. Of course, the first is screaming, ah, mommy, 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 and it's really sad to watch. Of course, as nurses will do what we can to comfort. Parent had to go for whatever reason, okay? Then all of a sudden they realize, mommy or daddy not coming back. So they stop crying. This might be a child who had stopped being having accidents, and they might be incontinent. They might have stopped sucking their finger and the thumb goes back in their mouth. They regress, part of stage 2. And then stage 3 is when mommy comes back and the child does not want any part to do with them because they were gone. They don't have to go through this anxiety again. Okay? Separation anxiety, 3 stages to it. Stranger fear, we know kids are afraid of everybody at first. It's just a normal reflex. And we know that peekaboo is going to start happening about that 9 months. We know they're going to start talking. What do infants do to start talking? They cry and they babble, right? Is that blah, 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 all the way around, right? And you can hear them in there talking to themselves. And we know infants play too, whether it's just looking at their hands. I think one of the things my newest grandson would do, it was his hands in front of his face, and he was always watching and touching it himself. And this gave him comfort. All right, we're going to be going to our first cahoots. How does that sound?
Can I ask a quick question?
Sure.
Back on the vaccines, you said that vaccines can increase the risk of SIDS
When you don't get them,
when you
the
don't
lack,
get them. Okay.
the lack of vaccines, because you'll get the disease, which will increase the
Right.
incidence of
Okay.
SIDS.
Okay. Thank you.
No, you're very welcome. I'm sure somebody might have had that question also. So thank you. Don't ever, ever, anybody be afraid to ask anything. If I don't know the answer, I will find it out for you. I like to be stumped. I challenge you. No, I'm teasing. I learn something every day, and that's the absolute beauty of nursing. And I've always said, when you stop learning, it's time for you to leave nursing, because now you're dangerous. Because nursing is ever evolving. If I told you what I started with in just an IV tubing up to what is today, I didn't know what an IV pump was when I started. There was no dial-a-flows. There was a clamp. That was it.
I have a question.
Sure.
How do I add myself to the Kahoot?
Okay, take your phone, put on your camera, point it at that little mix-up little square there. The site it comes to, that yellow thing, click it, and you can start from there. Did that help?
Okay, thank you.
You're very welcome. Okay, let's get going. Infants. In general, an infant should triple their birth weight at what months of age? I think you're seeing the one weight that you have to know is infants. And then you have to know if it's not there, what you should do, right? So it doubles at 6 months, it triples at 1 year or 12 months. So numbers you need to know. An infant should blank by 6 months their weight. We should double it by 6 months. Again, something, if it's too much, too little, it needs to be evaluated, because either could be a problem. Another multi. Infant nutrition includes. Now, I don't always get everything into every PowerPoint. So what I do is I put these little tricky things of differences into a Kahoot so that you get them.
I'm unable to enter. Get on Kahoot.
Just listen, it'll be okay. So with infants, one of the things is no honey for the first year. You know, have seen parents come in and tell me that their grandma told them that a little bit of honey helps with constipation. Remember, honey, we don't know if it's pasteurized, sterilized, and it's dangerous to give it to an infant under 1 year of age. Some books even say 2 years of age. And the other thing is no cow's milk until 1 year. Now, at 1 year, you can come off breast milk, you come off iron fortified formula and add just milk, but it should be whole milk. You need the fat. The fat in the nutrition is good for all the chemical synapses that go on in the brain. Multi. Infant nutrition for the first 6 months. So first 6 months, only human breast milk or iron fortified formula. This formula DHA, no. Lactose free, well, they could have, this might have one child who cannot be, who's intolerant to milk that would get lactose free, but again, it's going to be lactose free iron fortified formula. So that's the answer. A multi. Nutrition interventions for an infant include, what are things we need to know? Feeding an infant. Okay, infants, first 6 months, we know that they're going to only get iron fortified formula or just breast milk. If they're on breast milk, they're going to be getting vitamin D. When we start feeding them, it is one food at a time every 4 to 7 days. You must be on that one type of food. After that, there is no allergies. You can use that one again and add another new one. So we start that around 6 months. At 8 months old, an infant should be expected to perform which fine motor skill? So fine motor skills. So that's anything with the fingers. So 8 months old, they're now grabbing that rattle, and now they're starting to take those Cheerios and very smushing them with that pincer grasp, getting ready to almost get in that really fine one about 10 months. Which of the following is an example of fine motor skills in infants? So fine motor skills is only fingers. So rolling, crawling, jumping are all gross motor skills. This question is here just to show you to be careful when you're reading the question. So the only answer could be is that grasping with the fingers. Which is the correct order for development of gross motor skills in an infant? Gross motor skills. Remember, that's get up and go, go, go. And where does it start? So it starts with the head. So the head, we roll over, we get on our knees, we crawl, we start to creep around the couch, and then we start to hopefully attempting to take steps or walking by 1 year. At what age can an infant typically sit unsupported? So that is 8 months old. This is a typical question where they'll use and they'll put some other scenario with it. So this is one of those developmental ones that you should be aware. 8 months sitting unsupported. At what age does an infant typically start rolling over? And remember, understanding what time and when they're going to do it is that we can teach our parents, hey, your child's going to start moving and rolling now. Be careful when you're sitting them on flat surfaces. An infant's head circumference is so, as I said, at birth, this infant has a big head. As it gets to be about 1 year old, then the chest is going to be equal to it. And a little bit after, the chest will be bigger. It's just, again, the reference of size. Is the head where it should be? Is the chest where it should be? How do you apply nystatin to an infant with thrush? So giving medicines to an infant is going to be different than giving from a toddler, from a preschooler. With this, we're just going to paint it on there. Swish and swallow doesn't work. They're not going to do it. So you need to just paint it where it needs to go. Differences in adults and children. Blank is contraindicated for treating fever in children. We should never, ever give aspirin to children for a fever. In week 5, when we get to cardiac, you're going to see one diagnosis that you're going to give aspirin for to a child, and it's because we want to thin the blood for blood clots, okay? Never, ever give aspirin. Another thing, we only give acetaminophen to children, infants, up to age 6 months. At 6 months, you can start ibuprofen. The reason is something with platelet coagulopathy and bleeding, so they can't give ibuprofen earlier than 6 months. What is the primary goal in treating a fever? Why should I give something for a fever? Do they need to get Tylenol? And then I'll ask you, how do you feel when you have a fever? You feel like somebody hit you over the head, right? So it's for discomfort, just like for you, for me. But in children, the neat thing is once you take that fever down and it's no longer a fever, that child will be more active, will be able to drink more liquids, which you want them to do. So again, it's part of nutrition and getting fluids in the child, because with a fever, you have to increase fluids. Infants Erickson stage. What does Erickson say? Remember, Erickson is about how they deal with people. How does a baby deal with people? And it's trust. Very good. Thank you. Which pain scale is used to assess an infant? The flax scale, because you're looking at the faces, the legs, their activity, their crying, consolability, and it's also the same scale that is used for nonverbal children up to age 3, and nonverbal adults or children, doesn't matter. Flax scale. Good job. Thank you. Another multi. What is the best time to assess an infant? So when you have an infant in the mother's arms, quiet, sitting there playing, sucking on a toy, whatever, or asleep, this is when you're going to assess an infant. And what are you going to assess first? Breath sounds and heart sounds, because they're quiet. That's when you're going to do it. And remember, it's from least to most intrusive. Where should you place a car seat for an infant under the age of 1? Car seat, where is it going to go? It's going to be in a back seat, and it's going to be back facing up to the age of 2, and then you can turn it around. Which of these does tummy time help with? Tummy time, what's it good for? What is tummy time? I think it's a great time for mommy and baby to play. I know my older grandson does great tummy time with his new little brother. It's good for muscle development, coordination, and that Josephly for that head that's all squashed on one side, and it will help round it out. Very good. Which newborn can have an ABO incompatibility? Yeah, you learned that in maternity. I'm just re-mentioning it because now you have to have newborn care, which is pediatrics. So we know the incompatibility means this one and this one are different, right? So mom is O, baby is A, and now that blood is in there fighting. And it's releasing, bursting cells and bilirubin, and everything is going into the body and creating jaundice, right? Which intervention may decrease the incidence of physiologic jaundice in the healthy term infant? So you have a baby, you know they're ABO incompatible, right? What do you as a nurse, what can you do? You don't need an order for this. What can you do to help decrease jaundice? How does a baby get rid of that big jaundice in them? And it's starting to feed them now. You feed that baby and you'll start seeing the stool. So as a nurse, ABO compatible, you have an order to feed that child, you're going to feed it as soon as you can, because then you're going to get the stool out of them as quick as they can. And then it's going to stop the billy lights and all of the other stuff. An infant is NPO due to their medical condition. What is important to remember? So here's a baby. It's a tube in its mouth, can't eat. What do we know about infants and what do we need to do for them? I think part of it has to do with they explore the world with their mouth. They also decrease stress in their mouth, right? So any child who has, for whatever reason, cannot, eat, give them a pacifier, that non-nutritive sucking. And this can help them be calm and relaxed, and it's part of their development. They need it. A multi. The mother of a child suspected of having Munchausen syndrome. What should be in the care plan? Now, Munchausen syndrome is when a caregiver does things to harm their child. I've seen things like using toilet water, injecting it into IVs, having wounds and putting dirt or excrement in the wounds to keep it dirty. Now, it's a very touchy thing. We don't know if it's mom. We don't know if it's Munchausen. It's a big thing to accuse someone, but what can we do? As a nurse, your job is to protect, in pediatrics, the child. The child is in your care. You are there to protect it. If you suspect something, then we need to have a plan. And that would be every time the parent or whoever is coming in, they need to be supervised with somebody in the room at all times. Not when they leave, you don't need to have them there then, but when that parent is there. Also, they bring in anything, toys, they bring in food, all of that must be completely inspected, okay? Again, protecting the child is your job. a multi. Frequent developmental assessments are important for which of the following reasons? Why do I see if they're rolling over? Why do I see if they're sitting up? Are they walking? Can they, change hands? Why is that important? So we do these things because we can identify delays and deficits quickly. And when we get them quickly and identify it, we can institute early intervention quickly. Children are beautiful. When you institute these early interventions, they catch up so quickly and you never knew they had a problem. For instance, my first two grandbabies, both of them required speech therapy. They got speech therapy and all of a sudden you can't shut them up. They're just talking, talking, talking. So shows you can quickly turn them around, get them caught up before they get to preschool, before they get to, school. So this is why we do it, to help the kid be the best they can be, right? Moro's reflex. What's that? Startle reflex. What is it? There's a couple reflexes you have to know. So Moro reflex, startle reflex is you walk into the room, slam the door, and the baby goes, "Bah!" It's the hands and the feet come up. It's like they splay. It's a reflex to a noise, or it could be you bang the crib and as they splay. It shows a good reflex. A multi. What are risk factors for SIDS? So the one thing that's not is breastfeeding. In fact, breastfeeding decreases the incidence of SIDS. So it is, remember, SIDS from birth to 1 year old, okay? Highest incidence about 2 to 4 months. It's males, has to do with smoke, recent viral condition, overheating, that soft mattress, again, SIDS deaths. And last question, the rooting reflex, what is that one? So the rooting reflex is when you want to feed a baby. They don't know what to do yet. So you stroke the side of their chin and they just open their mouth and like they go for it, whether the breast or going for the nipple. And it works really, really nicely. Let's see how we did with this one. Number 2, Leandra. Good job. Number 2, Sarah. Good job, Sarah. Number 1, drum roll. Bing. Patience. Good job, Patience. Number 4, Christine and Daja. All right, so we've in the middle now. So now what we're going to do is go to our PowerPoint and we are going to finish with the toddlers. Hold on. Sorry. Any questions so far about anything? Do you like how coming from infant and then immediately testing on it, does that, do you like it that way?
I like it.
Okay. You did well.
I'll take like a 5 minutes break.
Would you like a 5-minute break?
Yeah. I want to use the
Okay.
restroom.
Okay, how about everybody? 5 minutes. It's 45. Come on back. 8, 9:45. Come back.